Hi, I'm Dr. Meenakshi Jain. I'm a board certified OBGYN and I'm practicing in St. Petersburg, Florida. I want to talk to my patients about benefits of robotic surgery. I trained in a program in Rochester, New York, where we learned laparoscopic surgery. And for the last almost about 20 to 25 years, I was doing a lot of laparoscopic and minimally invasive surgery. The traditional surgery which we offer to our patients, or the traditional surgery which is still being offered to the patients all over the United States, at least in gynecology, involves larger incisions, involves increased blood loss, higher risk of infection, longer hospitalization, and therefore more postoperative complications. So the benefit of minimally invasive surgery is unreputable. We know that any kind of minimally invasive surgery has smaller amount of hospitalization, less complications, less blood loss, less pain, and less incision size, and therefore better cosmesis. At this time, till about 4 or 5 years ago, in gynecology, 70% of hysterectomies, which is one of the commonest surgeries being done for GYN, was still being done as open surgeries, as traditional surgeries, even though we had procedures like laparoscopic hysterectomies and we had procedures with vaginal surgery. Even at that time, 70% of patients were needing to have a hysterectomy done by large incisions. Laparoscopic surgery has been available for gynecologists for almost about 20-25 years. But there's only 15% of physicians who were doing advanced laparoscopic surgery. In essence, it translates that most of the patients were still going to see gynecologists who were probably not doing advanced laparoscopy, and therefore the patients were still getting large incisions and having all the risks which were involved with traditional laparotomy, which is a large incision surgery. When robotics came into fruition, when we started doing robotic surgery, at that time there were many laparoscopic surgeons, including me, who felt that there was really not much benefit of doing robotics over laparoscopic surgery since they were both minimally invasive surgeries. However, after doing laparoscopy for almost 20 to 25 years and now doing robotics for the last about 6 years, I believe that robotics offers all the benefits of laparoscopy and then some. In laparoscopy, in a layman's term, it is a procedure which is done with a small incision where we put a camera which looks like a tube inside the patient's abdomen. We have instruments which are also straight, and therefore when you're trying to do a procedure, you are doing almost surgery with straight instruments with no bend. Technically, laparoscopic surgery is difficult to learn. And therefore, despite it being available for about 20 to 25 years, only 15% of gynecologists were offering it as a routine to their patients. In my practice, I was doing almost 90% of my cases laparoscopically, including 90% of the hysterectomies were done either vaginally or laparoscopic, which is a minimally invasive option. In contrast to the rest of the country, where most of the patients who were having hysterectomies were getting a laparotomy, so the incidence of an abdominal hysterectomy was 70%. Robotic surgery, when it came into fruition, has changed the spectrum of minimally invasive surgery. We are at this time doing almost about 60 to 70% of surgeries of hysterectomies in gynecology by robotics procedure. Robotics, in contrast to laparoscopy, has a magnification which is 10 times. We have 3D vision. The instruments are not straight. The instruments have a 360-degree turn. The instruments are like our fingers. So the delicate surgery, the dissection, is much better and much easier for the surgeon by doing robotic surgery versus laparoscopic surgery. So when I do a hysterectomy on a patient robotically, my patient comes in the morning. More than 90% of the patients are able to go home the same day. They have very small incisions, which most of them are hidden and are really not visible. The amount of blood loss is much less than traditional open surgery. These patients are advised that they need to walk on the day of the surgery and are able to drive in 4 to 5 days. Most of my patients need stronger pain medication only for a couple of days, in contrast to traditional surgery where they have a larger incision. So they are in the hospital for almost 3 to 4 days. They have much more pain. They have a large scar. Their blood loss is definitely more than what it is compared to robotic surgery. And the best part is that at this time, out of my 800 surgeries which I have done robotically, I have only had to open one patient. And thus, in my own practice, where I used to do laparoscopic surgery only till about 6 years ago, about 10% of my patients or 12% of my patients still needed to have a large incision. In contrast, I've only had one patient out of 800 where I need to make an incision, which was a large incision. As you can see, I strongly believe in robotic surgery, and I believe in giving this option to all our patients. I also have a passion for teaching. I have an epicenter in St. Petersburg General Hospital, which is one of 2 epicenters in the state of Florida and one of 26 in the country. We have surgeons from all over USA to come and learn robotic surgery, and I'm the mentor and a proctor in that program. I also teach robotics overseas, and I've been to India, in Delhi, Calcutta, and in Hyderabad to start their robotic programs in their hospitals. If you have any questions for me, I'll be happy to answer any questions. You can contact me by phone. You can leave a message on my page on Kaigi. I can also be available for you to have a video consultation if you have any questions about robotic surgery. Thank you for watching this video.